Ever wondered how eating disorders like bulimia and anorexia affect individuals and their loved ones? These two serious mental health conditions impact millions of people worldwide, creating an unhealthy relationship with food and body image. Bulimia is characterized by cycles of overeating and then compensatory behaviors like self-induced vomiting or excessive exercise. On the other hand, anorexia nervosa is marked by a severe restriction of food intake due to an intense fear of gaining weight. Both these disorders are deeply intertwined with a distorted perception of one's body. Despite their distinct characteristics, bulimia and anorexia share a common thread. They both stem from a complex mix of genetic, psychological, and environmental factors. Understanding these disorders is the first step in providing help and support to those affected. So let's dive deeper to understand these disorders and how we can help those affected. Recognizing the signs of bulimia and anorexia can be the first step towards helping someone. These eating disorders manifest in a variety of ways, and recognizing them early on can make a world of difference. Let's start with bulimia nervosa. A person dealing with bulimia might have episodes of eating much more food in a short period of time than most people would under similar circumstances. This is followed by feelings of guilt or disgust, leading to attempts to compensate through methods like self-induced vomiting, excessive exercise, or misuse of laxatives. Some physical signs of bulimia may include frequent fluctuations in weight, damaged teeth and gums, or a sore throat from repeated vomiting. On the other hand, anorexia nervosa is characterized by an intense fear of gaining weight, leading to self-starvation and excessive weight loss. People with anorexia may display a fixation on food, dieting, and body size. They might also develop ritualistic eating behaviors, such as cutting food into tiny pieces or refusing to eat in front of others. Physically, they could show signs of extreme thinness, fatigue, dizziness, or a bluish discoloration of the fingers. It's important to note that these symptoms can vary from person to person and may not always be obvious. For instance, a person with bulimia is often of normal weight or even overweight. Similarly, a person with anorexia might wear baggy clothes to hide their thinness. Also, these disorders often come with psychological symptoms such as social withdrawal, low self-esteem, or mood swings. Hence, if you notice drastic changes in someone's eating habits, body image, perception, or social behavior, it might be time to reach out and show your support. Remember, early detection is key to providing the necessary support and intervention, but identifying symptoms is just the start. In the next segment, we'll explore the impact of these disorders and the importance of seeking professional help. Scene script: bulimia and anorexia can have serious long-term effects on a person's physical and mental health. Let's begin by discussing the physical health consequences. Both bulimia and anorexia can lead to malnutrition. This is because these disorders involve either consuming insufficient nutrients or purging them from the body. Malnutrition can have a ripple effect on health, affecting everything from the health of your hair and skin to the function of vital organs like the heart and liver. In the case of bulimia, the cycle of binging and purging can lead to electrolyte imbalances. These are minerals that help your body carry out a variety of essential functions, including maintaining heart rhythm. An imbalance can lead to heart failure, one of the leading causes of death in people with bulimia. Anorexia, on the other hand, can lead to severe thinness and inadequate weight, which can cause a host of problems, from bone thinning to multi-organ failure. It's not just about looking thin, it's about the body not getting what it needs to function properly. But the impact of bulimia and anorexia isn't limited to physical health. They also have significant effects on mental well-being. People with these disorders often suffer from co-occurring conditions like depression, anxiety, and obsessive-compulsive disorder. The fear and obsession over food and body weight can consume a person's thoughts, affecting their ability to focus and function in daily life. Moreover, these disorders can lead to social withdrawal. The stigma surrounding them, coupled with the individual's own feelings of shame and fear, can cause them to isolate themselves from friends and family. This isolation can further exacerbate mental health issues, creating a vicious cycle that's hard to break. The impacts of these disorders can be severe, but they are not a life sentence. With early intervention and the right treatment, it is possible to recover and lead a healthy life. Understanding these impacts underscores the importance of seeking professional help. Recovery from bulimia and anorexia is possible with the right treatment and support. Treating these eating disorders typically involves a multifaceted approach that addresses both physical and mental health. Therapy, for instance, is a cornerstone of treatment. Cognitive behavioral therapy, or CBT, is widely recognized as an effective intervention. It focuses on identifying and changing negative thought patterns and behaviors, helping individuals to develop healthier relationships with food and their bodies. Another key component of treatment is nutritional counseling. Working with a dietitian, individuals can learn about balanced eating, the importance of regular meals and snacks, and how to manage food-related anxiety. This education is a vital step in restoring physical health and breaking the cycle of disordered eating. In some cases, medication may also be part of the treatment plan. While no specific drug can cure eating disorders, certain medications can help manage associated symptoms or conditions, such as depression or anxiety. It's important to remember that this should always be under the supervision of a healthcare professional. Equally important to recovery is a supportive community. This can include friends, family, support groups, or online communities. These networks can provide emotional support, understanding, and encouragement, making the recovery process less isolating. Hospitalization or residential treatment centers may be necessary for some individuals, particularly those who are medically unstable due to severe weight loss or other health complications. These facilities provide round-the-clock care and a structured environment, facilitating focused recovery. Lastly, it's crucial to note that recovery is not a linear process. There may be setbacks along the way, and that's okay. It's all part of the journey towards a healthier self. Remember, treatment is personalized, and what works for one person may not work for another. It's about finding the right combination of therapies and supports that best suit the individual's needs. Recovery is a journey, and every step forward counts. Raising awareness about bulimia and anorexia is essential in breaking the stigma surrounding these disorders. These are not just phases or diets, but serious mental health conditions that can have severe and long-lasting impacts on a person's physical and mental well-being. When we talk openly about bulimia and anorexia, we create an environment where those affected feel safe to share their experiences and seek help. This is a crucial step towards recovery. By understanding these disorders, we can also spot the signs early and provide the necessary support to those who may be silently struggling. Education is key. By learning about bulimia and anorexia, we can dispel myths and misconceptions that often fuel stigma and misunderstanding. We can use this knowledge to educate others, thus creating a ripple effect that can reach far and wide. But raising awareness is not just about knowledge, it's about empathy. It's about understanding the emotional and psychological struggle that comes with these disorders. It's about showing compassion and offering support without judgment. And how can you contribute to this cause? Start by sharing accurate information about bulimia and anorexia. Use your platform, no matter how big or small, to spread the word. If you're a teacher, incorporate discussions about eating disorders in your curriculum. If you're a parent, talk to your children about body image and healthy eating habits. If you're a friend, be there to listen and offer support. You can also donate to organizations that provide resources and support for individuals dealing with these disorders. Participate in awareness campaigns and events. Use your voice to advocate for better mental health policies and services. Remember, change starts with awareness, and awareness starts with you. By raising awareness, we can break the chains of stigma and create a world where those affected by bulimia and anorexia feel seen, heard, and understood. Together, we can make a difference. Share this video to raise awareness about bulimia and anorexia and help those who may be struggling to find the help they need.